I'm Dr. Kranti Vora. I'm part of 2024 India Leadership Journey, and I'm going to talk about my project, which is Surgical Unmet Needs in Urban Slums, a Gendered Approach. My journey started with BJ Medical College in Ahmedabad, where I did my MD in Gynae, and then I did my master's in public health from Johns Hopkins University in US, and my PhD from University of Maryland, College Park. Over the years, my journey took me to places like Afghanistan, Meghalaya, meeting with different people, and really enjoying and being passionate about my work which combine both public health and the clinical experience that I have. So let's talk about my project now. The project was about unmet surgical need, and we started off with a survey which was done some time ago. And what we found was that women were uh, having inequitable access to surgical care. About two-thirds of unmet surgical needs we found in women, and not always the reason was financial. And as it can be seen in the quotes in this slide, that it had social reason, it had financial reasons. Social reasons included who will do my work, and also they were not part of the Ayushman Bharat card. So the male in the family would have it, but women in the family would not have it. So all these findings, along with the survey finding that women are disproportionately affected, led to project where we deployed community health workers called Sati, and we trained women from the community itself to counsel women, to coordinate with the hospitals, find out the reason why they are not getting the surgery done, and connecting them with the right kind of authorities. And as you can see in the photographs, we did community meetings, and these are Sathis who are at work. So, as a result of the program, what we could do was to get women their cards, as you can see in the middle photograph. And also, some of the women did not go for consultation because they couldn't move on their own. So, Sathis helped them for that, identifying which doctor they should be seeing, and helping them with the consultation. Interestingly, majority of our women in the community where we were working had had at least one consultation. So that was not an issue, but the surgery itself was a problem because of, as I said, social and financial reason and fear that they had. So what we did was that we counseled them, and we tried to solve the gaps that were there. And as you can see in the last photographs, we would get them to the hospital, and Sathis would accompany them so that they could navigate the system much better than doing it on their own. So the project was very satisfying, and I really enjoyed working in the community after a long time, because I've been in academia for a very long time. And this leadership journey actually helped me to do my project in a much better way. And I like this quote from Jim Rohn, that as a leader, you always start with where people are before you try to take them where you want them to go. And this is photographs of our training where we trained Sathis. It was a skill-based training, and as you can see, we also learned how to do dressing on mannequins in that. And the best part of my leadership journey were the assessments that were done. The sessions that I had with my coach were very useful. And of course, meeting with my peers at Goa and enjoying with them. My future goals personally are to stay connected with the community, with my peers, and make more connection. And I like this quote by Vanessa Tucker again, that stay connected to feel empathy, compassion, and understanding, not just for yourself, but for others too. For the project, my short-term goals are complete the economic evaluation. We are using qualities for same and disseminate the findings to the stakeholders, especially decision maker. And the economic evaluation is going to include livelihood now, which it did not before my leadership journey. And the long-term goals that I have for the project is advocacy with developmental agencies and government so that this initiative can be scaled up and women's health can be improved, not just reproductive health, but women's health in entirety. And they can also have livelihood and feel proud of themselves and become financially independent. Thank you so much for your time and patient hearing. Thank you.